See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shauna Butler.
I'm Shauna Butler, the host of See You Now, a podcast that shines a light on the nurses addressing today's most challenging healthcare problems. And during National Nurses Week, that light is megawatt bright. Over the past few weeks, See You Now paused its regular format so we could share stories from the nurses in the midst of the coronavirus pandemic. As the entire world works toward breaking the chain of transmission and learns the fine art of physical distancing, self-isolation, and sheltering in place, it has challenged nurses to rapidly rethink and redesign every aspect of healthcare, particularly our psychological health. And when I say our, in this particular instance, I'm referring to our healthcare workers, those who on a daily basis experience the drama and the trauma of this deadly virus. Not only are they on the front line, they are behind enemy lines and surrounded by a deadly pathogen. On this edition, we meet nurse scientist Judy Davidson, who calls her attention to the mental health risks and even grave consequences of being in healthcare, and what works to save the lives of those who have dedicated their lives to saving others.
We are so much better at caring for others than we are about caring for ourselves. But now that we know the risks, we need to improve upon the way we care for ourselves at work and at home so we have the resiliency to care for our communities. My name is Judy Davidson. I am a nurse scientist. I was born and bred as an ICU nurse, then became a clinical nurse specialist, worked in and around the ICU for 25 years, then managed an ICU, and after that went back for my doctorate in nursing. Throughout that entire time, since the mid-'80s, I've been conducting my own research, first on clinical topics, things that just piqued my interest, and then something changed. At work, we had a series of suicides, nurse suicides, and that really shifted my whole life from that point on. I went to the literature and found absolutely nothing published about nurse suicide in the United States. I had to go back over 20 years to find anything about nurse suicide in the United States. Nobody had asked the CDC to look at that data to see if nurses were at higher risk. Doctors had done it before us. Other disciplines had done it. All kinds of people have done research on that data set, and the nurses were sitting there silently waiting to be seen. For all of the years that I looked at it, we were at higher risk, but nobody knew because nobody looked. The suicide data told us loud and clear that nurses who died by suicide had more job problems known before their death than the rest of the population. So there's something about the work we do that causes risk. And if you think about it, psychologists, psychiatrists, they have therapy their whole careers because of what they hear in their practice and what they may absorb from the negatives that they're hearing and treating. Why haven't we ever thought about that in nursing? You see the insides of people's bodies that you should not see. Half bodies, rotting bodies, people dying that look like your mother or your brother or your son. There's so much that we see that no human should see, and we see it for so much longer than anybody else. A nurse sits at the bedside 8 to 12 hours a shift, which increases the psychological trauma when you're looking at things that no human should really have to see. Our screening program, even though when I talk about it, I focus on the nurses, we do it for the entire organization. Once we realize we made the mistake once of leaving out nurses, why make that mistake twice or 3 times? Why didn't we include the housekeepers who mop up the blood? We have all of these programs that benefit everybody exposed to these risks in the healthcare environment. Learning together to become peer supporters across disciplines, it's very unique and it's fun to do that kind of learning together as a team. And now we're all looking out for each other. Last year, we even had a nurse save a doctor's life because of the program. She contacted the therapist, said, I've got a doctor today that I think is suicidal, and can you help him? And she asked him point blank, are you thinking of killing yourself? And he said yes. And she only did that because of the program, because we had been breaking down those barriers to stigma. And she saved his life. He was taken out of work that day, went to treatment, and then came back and is in much better space now that he's been treated. There's not a single solution to any of this. We're training peer supporters, do the pause after a death, but then our therapists that handle the suicide risk screening, they also offer group debriefings for groups that have been through a significant event. So that's in addition to routine screening. So you see how the pieces of the puzzle start coming together. We need resiliency building, skills building as a program structured in so everybody gets the training. We have peer supporters looking out for each other. We have therapists that can do debriefs properly if needed. We do screening so that we proactively find people in need. So these things add up to a solid, holistic program of helping each other and staying strong. I have a lot of concerns about the way COVID is affecting our workforce. Before COVID, we were at higher risks of suicide. Before COVID, we had problems with resources and work compression. And now look what's happened with COVID. If we do not take action proactively, a year from now, somebody's going to look back at the data and see that these suicides went up. They're going to see the psychological damage and harm to the workforce. We have to take action now. The hope is, the good part is, there are things we can do. That's the good part, if we just take action. We just hired 2 more therapists to bolster our program to be able to brace for what we're going to find when we screen nurses now. Anyone can start one of these training programs. It only costs a couple $1,000s to put it together, and that's a drop in the bucket to a life of a nurse. Contact the American Foundation of Suicide Prevention, info@afsp.org, and you talk to them about setting up a screening program. They'll help you get it all encrypted so that the nurses can feel totally safe disclosing their mental health issues. This is how simple it is. A simple email saves lives. The chief nurse officer sends out an email. You're encouraged to do this as a matter of self-care. When you go on to do the screening, it goes through encryption to the American Foundation of Suicide Prevention. Those that screen moderate or high risk are funneled back to therapists that are internal to the organization. They start a conversation through the computer. They don't know who you are. You don't know who they are. You can break your anonymity at any point in the process, or you can keep it all the way to being referred to a doctor. And it works. And it works because it's proactive. It's a push. We don't wait for people to say, I need help. You need to couple a program like that with boots on the ground, looking out for each other. Everybody feeling okay to approach somebody who's under extreme stress and saying, I care about you. Looks like you're having a rough day. You want to talk about it? That's actually a suicide prevention technique. Just recognizing somebody that's under stress and so they don't feel alone is a suicide prevention technique. And we can all do that with no money. We just have to start watching out for each other.
When the World Health Organization designated 2020 as the year of the nurse and midwife, nurses expected it was going to be a pivotal moment of global recognition, highlighting the vast contribution of nurses. However, as the coronavirus spread quickly across the globe, the call to action for nurses swiftly changed and also made clear this year's Nurses Week celebrations would be dramatically different. We're so good at caring for others. That's what nurses are celebrated, appreciated, and admired for. As we collectively experience the emotional toll of the coronavirus pandemic, it's the perfect opportunity to master raising our own hands, asking for help, and as they say on the airplane safety briefing, putting our own masks on first. Listening to Judy, I can't help but hear Bill Withers consoling us with his comforting voice and timeless sentiment. Lean on me when you're not strong, and I'll be your friend. I'll help you carry on. For it won't be long till I'm going to need somebody to lean on. Social distancing may be lonely, but you're not alone. Your life matters. For See You Now, I'm Shauna Butler. Thanks for listening.
Johnson & Johnson and the American Nurses Foundation are excited to launch the Coronavirus Response Fund for Nurses. Go to the American Nurses Foundation website to learn more, share, or donate. And thanks.